All right, ladies, let's talk menopause, the unavoidable part of womanhood that women dread and hate for good reason. And it's something that should never be downplayed because some women have a very rough road going through menopause. So let's take a really quick look at what's happening when women go through menopause. So your ovaries stop producing estrogen and progesterone. They've done their job through your life and they've tuckered out and they can't do it anymore. So when we see that fluctuation of hormones and we start to see that depletion, that's when women start to experience a lot of their symptoms like hot flashes, night sweats, weight gain, all of those things, trouble sleeping. It's because we have a depletion of those hormones. So there's so many things out there. Try this, try that, try this to help with your menopausal symptoms. And one of the things that we're seeing is birth control. And will birth control help? Is it a good idea? So first question is, will it help? Yeah, it might. Birth control is synthetic forms of progesterone and estrogen. So you are getting synthetic forms of them. Your body thinks that it's getting these hormones. And so in turn, you may have a decrease in these hormonal symptoms. However, is it the best option? And I would say no, because synthetic birth control is exactly what it says. It's synthetic, meaning that it's produced in a factory. It's not something that our body necessarily recognizes. It's not close to the production of what we were producing originally. So there are a lot of other side effect potentials, including the risk of DNA mutation, which can lead to cancers. There are other options and there are other opportunities that you can look at to help with menopausal symptoms, such as certain supplements, as well as bioidentical hormone therapy. What is that? So bioidentical hormone replacement therapy is hormones that are produced from plants. So they're very easily absorbed and they're bioidentical, meaning that they're bioidentical to what we produced in our body through our fertile years and through the years before our ovaries stop producing them. So the side effect profile is much lower, the body absorbs it much better, recognizes as much more normal, and like I said, the side effect profile and the risks are much less than synthetic birth control. Follow Forum Health for more information.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.